I wanted just to highlight particularly the report, because this event is designed to disseminate and highlight the key messages in the report. And I think they bear flagging internationally, because they are really important for governments all around the world trying to learn the lessons from this pandemic and to support the process of liberating the global economy from its grip. And the obvious message, the first message, is none of us are safe in a global economy until all of us are safe. And that has come through loud and clear today. But this report, if you haven't read it, please do. I have read it, and it contains a powerhouse, a treasure trove of really important insights in the lessons from this pandemic, and in particular the triple challenge of vaccines, equity, rollout, and manufacturing. And the important point that while a virus like this is mutating, and while we've still got high rates of transmission, we're continually creating an endemic system threat that's evolving the whole time. So getting the virus transmission rate under control is vital to, it's a feedback loop. And in particular, the report highlights some of the very powerful mechanisms that have been evolved in those countries on the front line. The flexible trading mechanisms, the vaccine diplomacy, the last mile delays, the issues about tackling, getting access right out to every corner of every country, the manufacturing capacity, supply chain issues, and the harmonizing of drug approvals. Some really important frontline lessons that need to be applied now to get this pandemic properly sorted and dealt with. The big lesson is to make our health systems more resilient going forwards. It's a really important report, and I just thank you all hugely for the work you've done in putting it together. It's a huge pleasure for me, 18 months on from those first phone calls last year with the idea of this commission, to now be joining you and to see the extent of the progress that's been made over the last 18 months. This is the third webinar global summit. Last year in November, we were framing the challenge that the COVID pandemic presents to the globe. Obviously, the immediate challenge of finding solutions and getting it under control. But then the lesson that it has tested every institution, from every individual, family, community, country, and global agency, and the global economy, and has been a huge wake-up call to the importance of systemic health economic resilience. I've never in my lifetime, as someone who's been in health policy and health innovation for over 25 years, I've never seen such a global recognition of the health susceptibility of economies. Every business, every sector, every national economy, global institution now talking about the value of health and the cost of disease. And that ultimately, if we can harness it, will provide the platform for making this year a genuine policy reset year, a year in which we commit at COP26 next week to a cleaner model of growth. But post-pandemic, we also commit to a healthier model of growth and to the global institutional commitment to integrating healthier and cleaner growth. And I say that as someone who's had a career initially in the health technology, health innovation, and life science space as Minister for Life Science here in the UK, and then as Minister for Decarbonisation of Transport. Actually, healthier growth and cleaner growth are two sides of the same coin. The vast majority of things we need to do to be healthier, to walk more, to take exercise each day, to eat more healthily, to try and move away from the long commute, car congested, polluting, inactive lifestyle modes of lifestyle of tomorrow, which the most advanced companies are streets ahead of and laying on and providing very healthy workplaces for their workforces. Those are the very same things that we need to do to reduce carbon dependency. And in the end, technology can play a huge part, and is. But in the end, it's the changes day in, day out to the daily routines of globalization, of growth, of companies that will actually drive cleaner and healthier growth together. And that's why when we set up the Commission, we've set out three core work streams. One is research, to make sure that internationally, through our Asia Pacific, India, European, UK, and North America hubs, and the hubs that we're planning next year, we're able to make sure that never again is public health and population health relegated as the poor relation of health policy, and that we make this pandemic a moment where governments, the OECD, the IMF, the international organizations, G20, G7, agree to make health economic resilience a fundamental part of our post-COVID policy reset. So that's the research part, to make sure that we link together the global centers of excellence in research. The second part is advocacy, which is partly what we're doing today, and it's what the Commission has done through our 18 commissioners, through the G7 and the G20 and the OECD and those other agencies. And thirdly, corporate engagement. And it's a defining pillar of this Commission that in the end, healthy growth will be delivered by business, by companies, by both established businesses with big global reach and supply chains, but also the new companies, the new insurgents, the new entrants, developing new technologies that will help deliver, measure, monitor healthier growth. And ultimately, our mission is to try and create an index, a set of metrics, a model that can allow us to measure by city, by company, by sector, by place, the degree of health economic resilience. Not just how much PPE we have stored, not just how ready as a country we may be to put in place and stand up the emergency procedures for managing the next pandemic or epidemic, but that much deeper commitment to systemic reform for structural health economic resilience, so that we think more clearly about the economy and the health system integrated, the economy healthier and the health system more economically sustainable. And those remain the three key pillars of the Commission's work. At the G7 in the summer, we set out three big messages, the first being the urgency of vaccine supply and rollout. And I'm really, really thrilled that today, with this report, we've set out a very clear and practical set of measures for that immediate issue of vaccine control. And I'm delighted to report that over the next year or two, we'll be rolling through those other issues of broadening that definition of health economic resilience, putting clear metrics around it, and working with global mayors and governments to make sure that we can build that framework, and working with industry to mobilize both health innovation and health technology companies' interest, but also the broader ESG and investor community interest in putting health at the heart of ESG funding. These are three really big work streams, and if we get them right, we will be able to look the future generation in the eye and say, we learnt our lesson from the pandemic and we made the necessary reforms alongside COP to lay the foundation for healthier and cleaner growth. Lastly, let me just say, my only regret in joining you today is that in joining as the newly appointed UK Minister for Science, Research and Innovation in the recent cabinet reshuffle, is that I will be stepping back from the active role of convening the Commission. And I wanted to say a very big thank you to all of those people, from our co-chairs, Jose Manuel, Malcolm Turnbull and Michelle in Harvard, to all of our commissioners, hugely eminent leaders in their fields, and to all the academics and our academic partners and hubs and all our business partners for your support. This was just an idea last year, and now we're setting the agenda for post-pandemic resilience, and it's an incredibly exciting and important initiative.